a number of that's fine. I've unfortunately met a number of Afro-Caribbeans who, I've seen them in a really bad state. Many of them quite young, coming down with quite severe high blood pressure, cardiovascular disease, and sometimes stroke. So I'm quite passionate about this message to African and Caribbean brothers and sisters. So I'm going to just let me know if you can still see my slides.
Yes, we can definitely. Thank you.
Good. So I'm going to put this on slideshow. After that, I may not be able to see you. Just let me know if you can see my slides moving.
Yes, we can.
Okay, good. So in this session today, we want to look at understanding high blood pressure, heart disease, stroke prevention, and specifically, we're looking at how specifically this is tailored towards the Africans and Caribbeans. How can we protect ourselves, protect our hearts, and support our families? It breaks my heart when young Africans, young Caribbeans die and leave their beautiful family because of cardiovascular diseases. So how can we help one another? We're going to talk about specific impacts that these has on us. We're going to look at practical lifestyle modifications that actually still respect our cultural heritage. We can still enjoy our Africanness and our Caribbeanness lifestyle, especially, and still not put ourselves at risk. How do we recognize early warning signs, and how can we access help? It's important to know that our health is the foundation of community. In Afro-Caribbean culture, the heart isn't just an organ, it represents the strength of our families and the longevity of elders. Important we take this seriously. We're looking at how we can protect family legacy. Protecting our health ensures that we are here for the next generation. This also speaks to strengthening our community, because when we are healthy, our communities thrive. And of course, we're talking about proactively encouraging wellness among us. It is a journey. It's a journey that we must take together. It's a journey that we have to be willing to take together. We have to support one another in this journey to make the right choices and keep ourselves healthy. So let's look at cardiovascular diseases. We have a number of diseases that come under this broad term. Coronary heart disease is one of them. So that's where you have angina, myocardial infarction, what we call in layman terms heart attack. Then you have peripheral arterial disease, is the effect of these things like high blood pressure and fat deposition in the blood vessels in the limbs. So people come down with what we call intermittent claudication in medical term. They begin to have pains in the legs when they walk a short distance, or depending on how bad this is for them. Of course, chief among them is stroke, which happens when there is an interruption in the blood supply of a particular part of the brain. And the fourth one is aortic disease. So the big blood vessel that runs from the heart and takes blood to the rest of the body is called the aorta. Sometimes that is quite diseased because fat deposits in it, and it's not as pliable as it would normally be, or because of high blood pressure, the just look at it as a hose, a pipe, it bursts, and that becomes a really big problem. So these are some of the diseases that come under the cardiovascular diseases. Now, one of the things we look at here is high blood pressure. High blood pressure is when you check your blood pressure now and it is 140/90 and above. So 140 is the top number, 90 is the lower number. The top number is called systolic blood pressure, and the lower number is called the diastolic blood pressure. So blood pressure of 140/90 and above. So if the top one is 140 and above, or the lower one is 90 and above, that is high blood pressure. Well, we don't check your blood pressure once and say you've got hypertension. There needs to be a consistently high blood pressure to say that one has the disease of hypertension. So that is why people would say, okay, the GP can ask someone to check their blood pressure consistently for like 2 weeks and bring the readings into the clinic to then determine if they need to go on blood pressure medication. So what's the effect of high blood pressure? One is that arterial damage. So just like water goes through a pipe, if the water goes through the pipe at a very high pressure, it can burst the pipe. If it doesn't burst the pipe, it begins to cause damage. First of all, is to the internal lining of the pipe, just like what you have in the principles of physics. So a substance consistently rubs against the surface of another, it can cause friction and all that. So arterial damage can happen. Apart from that, the heart comes under a strain. The heart is supposed to pump blood into the blood vessels. Now imagine if the blood vessels are under pressure, it means for the heart to be able to overcome the pressure of the blood vessels, it needs to, increase its own pressure. And at some point, the heart gets tired and then eventually fails. So these are some of the problems with high blood pressure. And the last thing is organ damage. Again, because blood is being pumped into all the organs. When this happens at a high blood pressure, imagine me squirting water on your face now. If I just pour water on your face gently, you feel the coolness, you feel the gentleness. But if I take a hose that is at a high pressure and I aim it at your face, you feel the pain, you feel the pressure on your face. That's what happens when blood is being squirted into those organs at a very high pressure. Those organs begin to get damaged. So hypertension is often the starting point of really serious cardiovascular problems. If it's not identified and managed early, this can become a big problem. So what happens generally in heart disease? The first thing we notice is apart from the first thing we notice is that, okay, if you look at the artery of babies, they are very clean. Inside it is very clean. There are no fatty plaques. They call them fatty plaques that are deposited inside. So imagine that this is the I hope you can all see me. This is the
Yes.
internal diameter of the blood vessel. Then as we get older and as we eat a lot of fat, what happens is that the internal lining of this blood vessel gets, a lot of fat deposits and begins to narrow the blood vessel like that. Begins to narrow the blood vessel like that. So what then happens is that the blood that's supposed to flow freely in that blood vessel is now flowing at a very high pressure through this blood vessel. So first of all, there's a narrowing of the artery. And one of the effects in the heart is that the person begins to have pain. Pain because the heart is not getting enough blood supply because the blood vessel is narrowed. And what then happens is that the muscles of the heart, they are not getting enough blood, they're not getting enough oxygen, they begin to die. So you see how high blood pressure, and as we're going to see later on in the presentation, intake of a lot of fats, increased cholesterol intake slowly causes really big health problems for us. The second one is stroke. Stroke is like the heart attack of the brain. So just like the heart can begin to die because it doesn't have enough enough blood supply, the brain also can have its blood supply cut off because of the effects of high blood pressure. So one of the things that can happen is that the blood supply can be cut off. That's when you have ischemic stroke. Ischemia means a lack of blood supply. Blood clots could just block the blood vessel, and that part of the brain that the blood vessel supplies does not have blood at all, and it dies. And then we see the manifestation outside as weakness in the arm, weakness in the face, weakness in the leg, or speech problems. The second thing that could happen is that because of the high blood pressure, the rate at which the pressure at which the blood is flowing through the blood